Hi everybody, I am Dr. Pradeep Shenoy, consultant rheumatologist, addressing you from Amrita Center for Rheumatic Diseases, which is located opposite to KMC Attawar. In this video, we will look into autoantibodies in SLE or systemic lupus erythematosus or lupus and their significance. SLE is the prototype of collagen vascular diseases which is mediated by antibodies. First antibody to appear in lupus is anti-nucleosome antibodies. Most specific antibody for lupus is anti-SM or anti-Smith antibodies. Anti-dsDNA titers correlate with the severity of lupus nephritis. Anti-ssANA antibodies are non-specific for lupus because they can be present in primary biliary cirrhosis, Sjogren's syndrome, viral infections and other vasculitides. And even in drug-induced lupus, it can be positive. Anti-Rho titers correlate with the severity of cutaneous lupus. SLE immune complexes typically stimulate classical pathway of complements wherein C4 levels go down first, followed by C3 levels. C3 levels recover first, followed by C4 levels. So at any given point of time, it is more likely that C4 levels are low. So to diagnose lupus, it is preferable to do C4. More so because some patients can have null alleles for C3, which means that they can have genes but those genes may not code for C3. So it's always better to do C4. So ANA positivity along with the C4 levels being low and along with the clinical features, one can diagnose SLE. C4 levels does not correlate with the severity of neuropsychiatric lupus. So to diagnose neuropsychiatric lupus, one has to do anti-neuronal P antibodies in CSF. Anti-neuronal P antibodies are rarely present in the serum because it cannot cross the blood-brain barrier. To detect the anti-erythrocyte antibodies which are attached to RBCs, one has to do direct Coombs test. To detect the anti-erythrocyte antibodies which are present in the serum, one has to do indirect Coombs test. Anti-platelet antibodies are rarely done because it is cumbersome to do for a microbiologist. It takes about 2 to 3 days for reporting. So it is rarely asked. Coming to antibodies, antiphospholipid antibodies which can be potentially present in SLE. To diagnose APLA, we do certain antibodies, anti-caliripin, IgG and IgM, among which IgG is more specific for APLA. Much more specific is antibodies to beta-2-GPI. Beta-2-GPI is a cofactor which is attached to phospholipids. Beta-2-GPI also involved in regulating the activity of complement system. Other tests are lupus anticoagulant, which involves APTT and diluted Russell Viper venom test. Lupus anticoagulant is a functional assay which checks the integrity of coagulation proteins associated with phospholipids. Apart from this, there can be warm antibodies and cold antibodies in lupus. Warm antibodies can interfere with blood grouping and cross-matching. If so, outside the body, that is in vitro, it has to be done by heating the apparatus to the body's temperature. From the room temperature, it has to be increased to the body's temperature. Then blood grouping and cross-matching can be done. So this is the summary of autoantibodies in SLE. My references are Dubois, lupus and related syndromes, and Lahita's systemic lupus erythematosus. Thank you one and all. Thank you.